How does punitive parent mode impact Schema-Focused CBT? Imagine having a voice inside your head that constantly criticizes you, judges your every move, and makes you feel like you're never good enough. That's what the punitive parent mode is. It's an internal critic rooted in early childhood experiences with parents or authority figures. This voice harshly judges mistakes, flaws, or even feelings, leading to feelings of shame, guilt, and self-hate. Over time, this mode can become a dominant part of how someone sees themselves. In Schema-Focused Cognitive Behavioral Therapy, or Schema-Focused CBT, the punitive parent mode plays a big role in keeping negative beliefs about oneself alive. It feeds into core schemas like defectiveness or unworthiness. Because the internal critic is so persistent, it makes it hard for people to accept positive changes or new, healthier beliefs. This mode keeps the person stuck in a cycle of self-criticism that resists change. When the punitive parent mode is active, it often triggers intense emotional reactions. Feelings like shame or self-hate can become overwhelming, making it tough to manage emotions. This emotional overload might cause someone to withdraw from others or even dissociate from their feelings. Sometimes, it pushes individuals into self-sabotaging behaviors, like pushing others away or engaging in perfectionism to try to control or escape the pain. This mode can also interfere with the relationship between the therapist and the patient. If someone is dominated by the punitive parent, they might see the therapist as critical or judgmental, which can make it hard to build trust. They might resist therapy or become defensive, making progress slower or more difficult. To address this, Schema-Focused CBT uses specific strategies. One key approach is helping patients recognize and challenge the harsh messages from the punitive parent. Therapists encourage them to dispute these critical thoughts and develop a more compassionate inner voice. Strengthening the healthy adult mode is also vital. This part of the mind acts like a caring, balanced authority that can soothe the vulnerable child mode and set limits on the punitive parent. The goal is to help the person develop self-care, assertiveness, and realistic self-evaluation. Supporting the vulnerable child mode is another important step. Since the punitive parent often attacks this part, therapy involves validating and comforting it. This helps heal early emotional wounds and reduces the power of the harsh critic. Additionally, therapists work to create a warm, empathetic environment that counters the expectation of judgment. This makes the person feel safe and understood, which weakens the influence of the punitive parent. Overall, the punitive parent mode presents a significant challenge in Schema-Focused CBT because it keeps self-punishment and emotional suffering alive. But by focusing on mode awareness, emotional validation, and strengthening the healthy adult, therapists can help reduce its impact. This process supports lasting change in core schemas and helps individuals develop a kinder, more accepting view of themselves.